Good day, and thank you for joining two of the NCTC Opioid Use Management webinar series. We invite you to connect with us via social media at PriCare Matters and via the website at www.primarycarematters.org. The National Center for Primary Care is located at the Morehouse School of Medicine. Additionally, the NCTC is a resource for encouraging doctors to pursue primary care careers, for making primary care practice more effective, and for supporting primary care professionals serving in underserved areas. The core principles of the NCTC are access, effectiveness, and equity. Thank you. Thank you both, Mr. Prokop.
I'm the CEO and founder of TruMedicines. And I worked at Microsoft for 16 years and worked on the Xbox Connect product, which is a computer citizen product. In 2013, I left Microsoft and started working on the tracking of pharmaceuticals. And the reason why I did that is people ask why do we need to track pills individually. One of the biggest reasons is that all types of pharmaceuticals have been counterfeited. And so the logos, the serial numbers, the barcodes, the looks of the pills have been counterfeited, and there's a wash of counterfeit pills around the world, and so there needs to be a method of identifying individual pills outside their packaging. Basically, when a pill has been removed from its packaging, there's really no way to identify that pill, unless you're an expert, and even experts have trouble. Another salient feature for clinicians is that clinicians, according to the CFR, needs to have a diversion control plan that prevents drugs that are opioids to get out of the hands of the patient and into people that weren't prescribed. There was a 2013 HHS survey done that said 68% of all opioids were legally cured, but were given by friends and family to opiate abusers. So that's a big problem that I think tracking individual drugs can help solve. Here's a slide that talks about the increasing numbers daily of overdoses with transitioning from opioids to heroin, and then laced with fentanyl. And fentanyl is the big problem we're facing right now. What happened in 2013, the Congress passed the Drug Security Act that was a 10-year rollout of when drugs were going to be tracked using various methods along the supply chain. The first big step in that tracking process was going to happen in October of this year, and there was a survey done by all manufacturers, and they found out that 3/4 of the manufacturers were not ready to implement a serialization of their products. So it looks to be a big problem with the big pharma's having, and what TruMedicines is trying to do is produce a turnkey solution for manufacturers that can track their drugs completely through the supply chain, from manufacturer through distribution center to the pharmacist. This slide shows a story about Walter White and his counterfeiting of drugs, and Walter White was actually replicated off a real guy named George Marquette, who was called the Wizard of Wichita. And George Marquette just got out of prison after 22 years, and George wasn't making meth in a lab, but he was actually making fentanyl. But fentanyl is a very difficult drug. George was able to manipulate the molecule so it looked like the drug he was making came from different laboratories, but actually George was supplying the whole country with fentanyl. Here's a picture of a sack of flour, and if you had a sack of flour full of fentanyl, you'd be able to produce over 1 million tablets, and you would get $45 million from selling those tablets. And then the next challenge coming up is carfentanil, which is 100 times more powerful than fentanyl. And of course, this becomes a real problem with smuggling of that drug into the United States because it's so small and so powerful that you could put 1 million pills in a salt shaker. So this is a problem that we're going to face for the foreseeable future with that. And here we have a demo of a of our application identifying a pill.
TruMedicines presents a live demonstration of our augmented computer vision app, which can read the serial number from the surface pattern on a pill.
This tablet of the antibiotic amoxicillin, Amoxar 500 milligrams, is genuine and made by GlaxoSmithKline. Please consume this tablet with food.
An interesting thing about this drug that it's identifying, it was a drug made in the Kilimanjaro School of Pharmacy in Moshi, Tanzania, under the help of Dr. Joseph Fortunak from Howard University. And it's a coincidence that last webinar, Dr. Chapman was also from Howard University, showing his app for a spoke and hub application in the Washington, D.C. area. So they're doing a lot of good work in Howard University. This slide is an example of how fentanyl can look like an oxy pill and very difficult to identify. But using computer software and computer vision, we're able to take a close look at these medications and identify all the spots and speckles that are in Schedule II drugs, particularly. And you've all heard this story that snowflakes are unique to themselves and no snowflakes are the same. Well, this holds up true with 5 speckled pills. It's like having 100 snowflakes on the surface of a pill. And of course, human eyes can't really see that, but of course a computer and cell phone camera can see all those little speckles. And so this makes this pill extremely unique, and that all pills are actually pressed with a unique identifier of the granules that they have inside the pill. And they've been taking pictures of pills for 25 years. In the pharmaceutical manufacturing process all around the world, in factories and at packaging stations, packaging companies. And here's an example of a high-speed camera that takes 130,000 images of pills an hour. They basically look for any cracks or misshapen pills during the manufacturing process. So what we're doing is leveraging that information, and we ask them to upload after a production on all the images they have of their pills up to our database, and so we can use our app to authenticate those images. And here's a slide of showing just that, where a user would take a picture of the packaging of the pill. It goes up to our cloud database and searches for that image. We do a match, and then we bring down that image back down to the cell phone, show it to the user, and also announce to the user what that pill is, where it was made, other information about that tablet. And this would help people that are illiterate or have low vision or even blind to be able to identify medications. So we think this is going to be a very powerful application for disabled people. Also, the application can announce the drug information in 52 languages, and so we're continuing to expand the capabilities of the audio software. And not only can we identify opioids, but we can also identify the medications that treat opioids. So here's a case where we're looking at buprenorphine, where it can identify the pill, and the patient would scan their pill on a daily basis, and that information of when and where the pill was scanned would be sent to our database and would have access by clinicians to see that a patient where that pill was registered to was actually taking their pills. So this allows us to have instant access to compliance information for that patient. So this keeps people on track. Here's again is a computer vision look of what that pill looks like up close. And on the right-hand side, you can see that the computer is able to automatically number each of the little granules in the pills. And so that becomes a very unique thumbprint signature for that pill. And this can also be done with other medications to help treat other types of alcohol abuse. So here we have one. And this is a final slide here where we have, it shows that the application called Deep Pill does machine recognition of the pills and allow us to track, trace, and authenticate pharmaceuticals post-market, as well as would help people keep compliance on their drug regimes. So we think it has broad applications for tracking medications. We also will publish this as a service in our website that will allow other applications to use our functionality within their applications. We realize that there are hundreds of healthcare applications out there, and that we would just become a feature of their applications to, identify the pill. And then we expect applications to help people with behavior modification, helping people change their behavior in stopping those urges for addiction treatment. So we think that's a very powerful method that people are going to continue to evolve that in the future. So I think that's the end of my presentation. Can I take some questions?
Wonderful. We are now open for question, discussion, and answer. Also note that the webinar presentation is linked in one of the pods below the presentation. Feel free to submit your questions to Dr. Prokop, and we will be fielding questions currently from registration. So the first question, what technologies have been found to be efficacious for increasing compliance and prolonged abstinence of opioid use?
I can take a crack at that one. There was a list produced by the Substance Abuse and Mental Health Services Administration that provides a document for e-therapy. And in that document, it has a listing of all the studies that e-therapy was able to help populations and how it was used. So I would encourage people to take a look at that document and see how it fits their particular situation.
Our next question comes from Keisha. Is the Deep Pill app currently available, and are there any plans to make it an iOS app?
This technology, we hope to have it launched next year, and it will be Android and iPhone.
How can clinicians and health professionals leverage technology to mitigate the stigma around opioid use and to promote help-seeking behavior?
A lot of applications right now on the Android platform. I haven't looked at the iPhone, but if they are able to do a search on Google Play, for instance, and bring up applications, there's quite a few applications that are put up by insurance companies. Aetna has got a couple of wellness and well-being apps. There's some drug addiction applications out there that help with behavior modification. There's quite a few free apps out there that try and help people modify their behavior, try and reduce the urge. There's some quit smoking apps, for instance, that are out there to help people stop the urge from smoking. And some of the research suggests with smoking that if they're able to just prevent the urge for the next 5 minutes, that urge will slowly go away and they won't have the cigarette. So I know that doesn't work with opioids, but these kind of behavior modification applications are available out there. I do think also that several of these applications have 24-hour hotline numbers that I think should be included in all those applications to give people sort of a safety net when they, are 2 o'clock in the morning and they're feeling kind of down and they need someone to talk to, that they can pick up their phone and they can call one of these hotlines and have someone walk them through it. So I think those support mechanisms have to be available, and they have to be more widespread through technology.
So how can health professionals and clinicians use technology to engage low-income patient populations who don't necessarily have access to technology?
Found a $50 Android phone on Amazon, and it works beautifully for our applications with the latest and greatest operating system for $50, as well as most of the carriers, cell phone carriers, T-Mobile, Verizon, have low-income plans that, in often most states, they have actually a free plan available, and people just need to be aware of that. I'm sure they apply for it, and they can get free data plans to complement their phones.
How your applications or your software reduces the risk liability to practitioners while simultaneously protecting the patient information.
Well, quickly I could just describe how we encrypt our information on the phone, and then while the data is sitting in our cloud database, the information is encrypted while at rest. So during transmission, it's also encrypted. So it can't be stolen, and it's using the Microsoft Azure platform that has all the government credentials for privacy protection. So we're confident that we're fully covered in that with TruMedicines and DeepHealth.
Do you believe that the use of technology will make it more challenging for rural providers to practice?
There's a law in place that allows telemedicine. If there's a video link, say it's FaceTime, with a doctor on your phone, that application that has the FaceTime real-time audio link and video link with a doctor or health care provider, that type of application is covered under Medicare Part B. So I think a lot of technologists don't know that, and I think they should start building that technology into it so it will be covered and allow rural practitioners to have a phone call, a video phone call with their patients, as opposed to having the patients come in to the site.
What role can data analytics play in helping to resolve the opioid crisis?
With TruMedicines, we have a sort of a low-tech approach. Every time a pill is scanned, we identify the GPS location of that pill where it was scanned. And using all this aggregated information, we can create a heat map of where the pills are being scanned in a city, and we can see, for instance, if we were looking at Tamiflu, for instance, we would see that a particular area of the city was hardest hit with the flu virus, and then that would allow public health people to concentrate on that area to do a little bit more public health service announcements or target that area for trying to reduce before it became an epidemic. So we think that just getting not big data, but just getting the location of where it's been scanned, we can leverage that tremendously in getting real-time data in where people are taking the medications and where they need help.
This is the first time we include community health workers into the care team to reach out and to work with opioid users. How should we use the community health worker role, and what tasks should they engage in when working with opioid users in the intervention process?
There's a program in Boston called Anchor that uses ex-addicts to help out outreach programs for Anchor, and they've had a pretty high success rate because people who are ex-addicts obviously know the problem, and they're very adept at getting some of these people into treatment programs. So I think that particular model is quite a good one, and I think that should be encouraged.
How can we leverage the use of telemedicine to manage the opioid crisis?
I also think a clinician could split their patients into high-risk and low-risk populations. The high-risk people, you would want to closely monitor their compliance with your program. The low-risk, you could give them the software application and monitor them maybe less frequently, and let them kind of go off and do the program on the electronic phone, for instance. And I think this would allow the doctors to kind of concentrate their time on the high-risk patients. So I do think we'll help them with their time management.
Okay, thank you. Next question. Can you suggest any tools that are free to download and which are currently available?
The website by Sam Hasser, the Substance Abuse and Mental Health Services have been, they have every year they do a challenge for applications for MAT applications, so Medical Assisted Treatment Programs, and so they have a whole gang of applications up there that vie for the award. I believe it's $20,000, and maybe next year might be $50,000 award. So there's quite a few applications up there on that website. So that's something to check out.
So we will wrap with our final question, and this is: what do you forecast in the next 10 years for technology, mobile health interventions in the space of addiction treatment or pain management?
I see software getting smarter and more personal with the user, and I think we're really going to have personal assistants that can help you manage your medications, manage your appointments, help you in your day-to-day life, like your own personal secretary or assistant that helps you just manage your life. And I think it'll help you manage your medications as well as other issues with daily life. And I think applications are going to get smarter and smarter to be able to know the person that owns them and allow them to help them in ways that are needed. So I think the future is very bright for smart technology.
And thank you for an extremely engaging and informative presentation. Additionally, we encourage you to complete the full opioid use management series. Part 4 is scheduled for November 15th, and Part 5 is scheduled for December 13th. As I stated at the beginning of the webinar, the presentation is available for download now, and you will receive an email with directions on how to access a CME credits. On behalf of the National Center for Primary Care, we thank you for your attendance at today's webinar, and have a wonderful evening.